So this training is entitled Fire Prevention and Emergency Response. Here we're going to talk about what the fire department requires and how you're also going to handle emergencies in your facility. These are medical emergencies in your facility. So let's take a quick look at what the fire department requires you to do. The first thing that any fire department is going to want to have in your facility is anything that could be a fire hazard, such as paper clutter, certainly blocking any exits with boxes and things, frayed wires, broken outlet covers, any type of plugging too many equipments into one particular outlet where you could cause a power surge and cause a fire. And of course, earthquake is another concern of fire departments. Certainly items that are heavy, that are made of glass, especially, or metal that are stored above 5 feet, they can fall on your head. These are things that you need to watch out for. Cabinets that are 5 feet or higher need to be secured to the stud in the walls so that they don't fall over. There are other things such as storage of flammable items within the facility where you have to have a fire cabinet and make sure that they're safe in a fireproof cabinet. Smoke detectors, fire alarms, the list goes on, right? So we're going to go through and give you some specifics. Like next, one of the things that's very important is if you deal with flammable items, you need to have proper ventilation for flammable items. If you work in a pathology lab, for example, where you deal with a lot of flammable items such as formalin, methanol, things like that, you need to have a good hood, where it's actually taking the vapors, flammable vapors outside of the building. Then you also have to, again, make sure that any means of egress, that means a way of escape, is not blocked. You don't have a desk or a cabinet in front of an exit door. You don't have boxes piled up in front of an exit door. These are things that are very important. Clean work areas, which we talked about already. Storage of flammable items, which we already talked about. Fire extinguishers, we talked about those in several other videos. Fire extinguishers, again, are important. You need to know how to use them. We have an acronym called PASS or PASS, which is a great acronym to remember when you're using a fire extinguisher. P stands for pull the pin to release the trigger. A is aim at the base of the fire, which is usually the blue area of the flame. The next S is squeeze the trigger and hold the trigger until the fire is out or the unit runs out. You do not want to do bursts, because if you do intermittent bursts, sometimes the unit jams because there's a lot of pressure coming out and it jams the switch so it doesn't go again. So they recommend that you hold the trigger until the fire is out or the unit runs out. An average fire extinguisher empties its entire content within 10 to 15 seconds. So you really need to be aiming at the right place, and you need to keep a good distance of 8 to 10 feet if it's a large fire. If it's a small fire, like maybe a trash can fire or a computer fire, then you need to be a little bit closer to make sure you aim at that exact spot. Otherwise, you're going to make a giant mess everywhere. So again, the type of fire extinguisher you should be using is very important. Most of it is CO2 fire extinguishers. They're called ABC, which stands for A for any regular fires like fire of any type of wood, paper, plastic, things like that. B is for chemical fires, grease fires, any type of flammable liquids. And of course, last C is electrical fires. And almost all fire extinguishers are ABC, and they will work on all of those basic fires. And then there's some special fire extinguishers that are made for electronic equipment, computers, things like that. You can certainly research and see the best fire extinguisher for the use that you need. Your fire extinguishers have to be rechargeable. They cannot be plastic. They have to be metal and refillable units for a commercial use. They need to be mounted 3.5 to 5 feet from the top of the fire extinguisher to the floor. And they have to have a clear sign above them that says fire extinguisher in all caps. The tag that is usually on the fire extinguisher, the date on that tag is the last inspection date, not the expiration date. You need to add a year to that date to come up with the expiration date of the fire extinguisher. And the last S on the acronym PASS is sweep from side to side, especially if it's a large fire. Sometimes fire extinguishers are used to escape from an inferno. So if you're trying to get out of an area and it's all engulfed in fire, you can use a fire extinguisher to extinguish an area for you to break through And you can actually use the fire extinguisher once it's completely empty as a battering ram to get out of the doors or windows, break windows to get out of the building. And so that's pretty much all I wanted to say about fire extinguishers. It's also important, before we go any further, to check the level of the fire extinguisher. There's a dial on the fire extinguisher that has a yellow arrow, and it's got to be in the green area of the pie chart there. And certainly the thing that we check on a fire extinguisher on a regular basis once a month is the seal around the pin. It's a plastic breakaway seal, and you want to make sure that seal is intact. That means no one tampered with the fire extinguisher prior to using it. Storage of compressed gas cylinders, very important. If you have gas cylinders in your facility, they have to be chained or metal cabled to the stud in the wall. So you can't just be leaning them against the wall or standing them on its end or laying them on the ground, okay? They need to either be in a cart that looks like a metal cart that they sit in, or a cart that rolls, okay? Those are all fine because they won't tip over. Or they need to be chained if they're permanently there for your treatment facility. They need to be chained or metal cabled to the stud in the wall. So that's very important. The next thing is the evacuation maps. A lot of people ask me, do I need evacuation plans for my facility? The answer is yes. It is required by different agencies. But where do we put these evacuation plans? Well, once you have your evacuation plan, which basically is just a simple map of the facility, doesn't have to be perfectly to scale. As long as you identify all the safety equipment within the plan on your map, such as eye wash station, first aid kit, emergency kit, fire extinguishers, spill kits, oxygen tank. Those kind of things are important to be located on the map. Then you place these maps in different areas where it's hard to see where the exit is. Like if I'm standing in an exam room and I look out the door and I can't see where the exit is, whether to go right or left, then that room requires a map right by the door panel, which is maybe eye level, about 5-6 feet up, and on the wall right by the door frame, I mean. So then that's something you do throughout the facility wherever it's needed. If you need any further instructions on how to place these maps or what they should look like, please contact us and we'll walk you through it, and we'll even send you a sample map so you can use as an example. The next thing is the evacuation drills. We talked about these before. You need to make sure that you do an annual fire and emergency evacuation drill. And we did discuss that in detail in our new hire packet training, part of the initial employee training. So please refer to that on how to do a proper fire and evacuation, as well as an emergency earthquake drill if you like to do that. That's optional. Then, of course, you have to have a designated meeting location outside of the building. And this location has to be very specific, such as by the mailbox or on the southeast corner of such and such street. And the location has to be at least 75 feet away from your building, and you do not have to cross any streets. So it has to be somewhere on your side of the street where you're not crossing any streets to get to it. So just go up the block or down the block and pick a place. If there's a Starbucks, for example, you can say in front of the Starbucks or by the building sign, in the entrance of the building in the parking lot, or maybe pick a parking spot or maybe a light post or whatever. It doesn't make any difference what it is as long as it's specific so everybody knows exactly where they're supposed to meet, because it's important to make sure everybody made it out of the building, and that's very important. And of course, if you have a compressor use in your facility, that means you're maybe a dental facility, you want to make sure that you have a permit for that compressor, as well as the proper signage, which says, caution, compressor may start automatically. That has to be posted near the compressor. And if you have the vacuum system all there, you got to make sure that your vacuum traps and the amalgam separator is labeled with an amalgam chemical label, as well as a biohazard label, which we usually take care of for you, or you have to do this yourself, and you can obtain those labels from us by contacting us. Then the last thing that they pay attention to is record keeping. Again, your annual fire drills needs to have a record of that. If you do an earthquake drill, also have a record of that. And any inspections that you're doing on a monthly basis for fire and electrical safety certainly need to have records of all of those. And any training that you do in this area should keep records of that as well. Now we come to an article that I like to read for you. which deals with emergency response. Now, in this particular case, an Anaheim physician by the name of Andrew Rutland was performing a procedure. He was an OBGYN, and he injected his patient with lidocaine during preparation for an abortion. And this particular patient went into allergic reaction. The patient was in full cardiac arrest when paramedics arrived, and the patient died 6 days later. Now, whenever, God forbid, this ever happens to any medical or dental facility, somebody's going to come and inspect you. Somebody's going to come and ask, what happened here? How did this happen here? And you need to have certain things in place to show that you did your part for preventing this from happening. And if you cannot show these things in place, then you could be in a lot of trouble. This doctor was not prepared for emergencies such as this. So here, when they did the inspection of the facility, they found that the facility was not adequately equipped to handle emergencies. It says here, the emergency medical kit did not meet the standard of care, which means it was missing a lot of items, as well as the fact that it contains several expired medications. That's a big no-no. Also, they found out that no personnel on site was currently certified in CPR. And certainly in dental offices, pretty much everybody has to be CPR trained. In medical facilities, you have to at least have one person trained in CPR with current certification anytime you're seeing patients at any given point. There has to be one person at least in the facility. And it says, and Rutland failed to recognize lidocaine toxicity. That means he was not familiar with the signs and symptoms of allergic reaction to lidocaine or any other type of emergencies. So I'm really surprised that the doctor, with all of his training, was not familiar with these types of signs. And it says he did not respond in a timely manner in performing appropriate resuscitative measures. It means they didn't start CPR and he didn't do anything that he was supposed to do. There was also a significant delay between the time of his patient's reaction to the medication and the time the emergency personnel were called. So he took his time. He didn't call 911 or had any of his staff call 911. By the way, in the state of California, it is a state regulation and the law that any individual within the practice of dentistry or any physician's practice, if they recognize something to be an emergency, a medical emergency, they do not need permission or authorization from the dentist or the physician to call 911. So they're protected by law, and they cannot be reprised for any reason by the employer. So be careful with that. If anyone calls 911, they haven't done anything wrong. As a matter of fact, as an employer, I would recommend that you encourage that, and that's good for you because the liability transfers to the paramedics once they arrive. So that's very important. Additionally, they found out that this doctor failed to obtain malpractice insurance, which is another violation of the Business and Professions Code. And he also failed to report to the medical board that his patient was transferred to the hospital emergency room, and that's within 5 days, by the way, and then failed to report the death of the patient to the medical board as well within 5 days again. And so obviously he was trying to hide this from the medical board. And eventually, in conclusion, while awaiting a hearing in this matter, Rutland stipulated to the surrender of his medical license, and the stipulated surrender was adopted by the Medical Board of California on January 20, 2011, and is effective February 11, 2011. So he lost his medical license. And again, here's what we promote to you or propose to you as your office emergency protocol. This is your medical emergency protocol. Now, whether the patient has a heart attack in the waiting area or they have a problem, a medical condition, emergency, when they're sitting in your exam room right after you injected them with something or gave them any kind of medication, this is still a medical emergency. Now, one of those is not reportable to the medical or dental board because you did not cause that. If the patient had a heart attack in the waiting area, you hadn't done anything to the patient, that is not a reportable incident. But if it was caused by something that you did, then that particular incident is a reportable incident to the medical board. But there's also some other stipulation. But we get to that in just a second. So the first thing you want to do in your emergency protocol is listed here, is you're going to identify the emergency. Now, obviously, a doctor or skilled clinical staff should be the one determining that, but anyone could determine that. Second thing you want to do is you want to notify your staff to call 911 from a landline, preferably, right? You don't want to be using your cell phone to call 911, because when you do that, at least in California, the call gets routed to California Highway Patrol first. Then they try to figure out what's going on, because they're thinking you're stranded somewhere on the highway. And that's why you're using your cell phone. Landline, the address of your location pops up on their screen instantly, and they immediately send somebody to your facility, and it gets automatically routed to the nearest fire station nearest to your location. So that's important to use a landline. And certainly nobody knows where you are when you call from a cell phone. You have to give directions, and so that all takes time. Then within 3 minutes, we recommend that you send someone outside of your office to flag the emergency personnel down to your location, and even all the way to the victim, wherever the victim is. And that's important that you do that. And usually get there within 5 minutes. Then, of course, number 4 is you immediately administer CPR. And certainly a CPR-trained staff must be doing that. And in order to administer CPR, you must have proper equipment, such as what? An emergency kit or crash cart with no expired medications in it. Certainly portable oxygen supply that has been designated for emergency use only, and it's got to be ready to go, ready to use, with the hose attached and everything that you need right there. At least half-hour supply of oxygen at 4 liters per minute. And of course, C, you must have an ambu bag with the right size mask, depending on the demographics of your patients, whether you have adult and pediatric patients. You have to have 2 size masks. And also you have to have an automated external defibrillator if it's required for you, meaning you have a crash cart. And that's usually a facility that does general anesthesia, IV sedation, or conscious sedation. You have to have that as well. Then an E is spill kit. You need a bodily fluid spill kit at a minimum. And, of course, a good, well-supplied first aid kit with, again, no expired meds in it. And then number 5, once the paramedics arrive, you let them take over the care of the victim. And then if the particular incident was caused by something that you did to the patient, and the medical emergency was caused by that, then that's a reportable incident to the Medical and Dental Board of California. Here's the difference between medical facilities and dental facilities. In medical facilities, if the patient was transferred to the emergency room, that's a reportable incident. For dental facilities, the patient has to be transferred to the emergency room and stay overnight for treatment before it's a reportable incident. And certainly in either case, if there's a death of a patient or a victim, then that is also reportable to the medical and dental board within 5 days from the incident. Now, if the particular injury was to an employee, not a patient, this is not reportable to the medical or dental board, but rather reportable to Cal OSHA within 8 days from the incident. So if it's an employee incident, and again, the employee has to be taken to the emergency room and stay overnight for treatment before it's a reportable incident. Otherwise, it's just if they were released the same day, then it's not reportable. And that pretty much covers our office emergency protocol. And that concludes our training for fire emergency response, fire prevention and emergency response. Again, thank you so much for your time.